All right, everyone. Welcome today, and we want to talk about really the dentist's role in brain and mental health, which is I'm super passionate about this because I have a personal journey. um, First of all, my name is Cheng Ruan. For those of y'all who don't know me, I'm an internal medicine doctor here in Houston, Texas, CEO of Texas Center for Lifestyle Medicine. But I've been a bit obsessed about improving brain and mental health over the last few years. And part of the reason is because I see that there's a lot of issues with, like, there's stigmas in mental health and in brain health that we really haven't had a whole lot of answers to on the medical side, right? So whatever it takes to actually improve the outcomes on the medical side, we want to take into consideration. So there's been a lot of studies that's done on the correlation of oral microbiome, infections, toxicities that affect the brain, really stemming from the mouth. And this is not talked about a whole lot or at all, actually, within the medical education system. And I don't think it's talked a whole lot about within the dental educational system either. But it's a big deal. And this comes at a time where we're kind of in the pandemic phase right now, where everyone's kind of questioning, why is brain health, mental health worsening? Why is there increased diagnoses of Alzheimer's and Parkinson's, ADHD? Like, what is going on, right? And why is it accelerated really over the last few years? And there's actually simple explanations to it, but we just have to kind of put it all together. And today I have Dr. Liao in. I think he's on right now. Hey, Dr. Liao, how are you doing?
Hi, good morning.
Good morning. Thanks for hopping on
Right,
so
thank you for
early
putting
on a
on this.
Sunday. Yeah, go ahead.
Happy to join you.
No, thank you. And I feel like it's really important to put together the medical world, the dental world, and as Dr. Liao calls it, the mouth doctors, right, rather than dentists, and also this separation between dental and medical really needs to start going away. We really need to merge the whole world together because there's so many answers that can be had in really like puzzling medical cases, especially not just brain health, but especially in brain health and mental health, chronic pain syndromes, fibromyalgia, et cetera, you name it. But we have to have a foundation for putting the things together so we can say the right terms and do the right things. And so if we want to kind of, start thinking about the mouth as the entry point, right, of things that are external, and the mouth will receive it as the entry point, and the entire skull and soft tissue structure will decide what to do with that information. It's like the input output, right? So it's like our body's a computer, and part of our computer and part of that processing includes the entire oral and nasopharyngeal airway. And if that processing gets impaired, which it does in a huge portion of the population, right, then we see sort of these end stage diseases or even beginning stage diseases. So it can start with mental health issues, anxiety and depression and bipolar and ADHD. It can start with that. And then it can turn into more medical issues like hypersomnia, diagnosed narcolepsy, obstructive sleep apnea, right? And then that can become, over time, more destructive things in brain and mental health, which could be Alzheimer's disease or some sort of dementia or vascular dementia, right? And so by putting it all together, we have to see it more as a flow and a sequence and a spectrum rather than a siloed sort of disease state. And that's important to figure out. And so, Dr. Liao, I'm going to have you ask you a few questions on this, and we'll kind of get the discussion started, right?
Absolutely, yeah.
And so let's partition the talk a little bit. First, we'll talk about the mouth as sort of a receiving signal, the airway, if you will, right? And then second, we're going to talk about the mouth as a chemical signaling pathway and biological signaling. And I think it's a really cool to put the two worlds together. So Dr. Liao, give me your thoughts on the mouth as a receiving signaling pathway in terms of an airway organ.
Sure. So the mouth is to humans what roots are to plants. Every one of us come into this world out of, being after the coming out of the birth canal, we are given a spank to open up our lungs and then get fed, right? And then after we get fed, we fall asleep. And what happens after that? You repeat the cycle, less the spanking. And this is how every one of us grew, all right? And the role of the mouth in whole body physiology really does not change after that. In fact, I have a good friend who, after he heard me make my proposition, came back on a Monday morning and said, I went home and watched my dog over the weekend and thought about what you say. And really, a dog is nothing but a mouth mounted on 4 legs.
Mouth on 4 legs.
And I said, well, the humans are a mouth mounted on 4 legs. And so there's a homunculus diagram that I'll dig out as the talk goes along that shows that the human brain is preoccupied with the brain. I mean, with the hand and the mouth. So that's basically how we are hardwired for the hunting, gathering, in order to satisfy the mouth as a like Dr. Cheng says, the entry point, the intake portal for the whole body. And the mouth role really includes
weird talk pattern throwing me off.
the mouth. The mouth role really includes alignment, breathing, circulation, digestion, energy, and sleep. It's not just for smiles. It's not just for chewing. All right. The physiological functions of the mouth that we treat every day as mouth doctors actually includes alignment, which relates to pain, breathing, which relates to snoring and sleep apnea, and included with that is nasal obstruction, all right? And then circulation that relates to hypoxia, absolutely, yes. So everything else pales in comparison as far as the brain is concerned, okay? This is the number of, thank you, this is the number of neurons. Whether sensory and motor, it's the same. Number of neurons devoted to each part of the human body. That's the definition of a homunculus.
Yeah. So
vision, vision is big, and vision and nose and ears are really all there to serve the purpose of the mouth. And the hand is really to get whatever we hunt down or pick out a tree or dig out of the ground to feed the mouth. Thank you. Yes.
Yeah, so this is the human homunculus, and I'll kind of break it down really quickly because this has to do with the association of anatomical parts of the brain and how much of the neocortex and portions of the brain are dedicated to systems. So this is an actual visual representation of how much the brain is dedicated to the system. So as Dr. Liao was saying, is that do you see this the amount of real estate, if you will, that the brain dedicates to oral function in the mouth? That's right here. It's a lot. And so the tongue has an incredible amount of brain real estate dedicated to its function as well, and so are the hands. Yes. So in essentially, the body's design is for that hand-to-mouth feeding, and also that reception of information, the touch and the proprioception and the functionality of the mouth is incredibly important. Now, I've seen this in medical school. I have. I didn't really think anything of it. And I just find it really interesting that we're bringing it full circle right now, because the first time I saw it and in school, that was probably, I guess, 2006, is when I was in school. The way I thought about it is that, you know, we're kind of creatures that dedicate so much of our neurons to sensory, but what I didn't put together is how much of that actually controls to a disease state. And so we look at this human, the homunculus. The idea is that if we dedicate so much of this to particular areas, should we assume those areas are quite important? And the answer is yes. Now, no, Dr. Liao, the problem, I think, is that there's a big disconnect here, right? Between disease state pathology versus what's really taught as an underlying function. So in medical school, this is how medical school works. You have the first 2 years is dedicated to, you know, clinical science, right? Dedicated to the basic sciences, right? And then that's where all the books and stuff comes out. And then you have 2 years dedicated to the clinical science. But I never really saw the homunculus beyond, you know, the first 2 years, right?
National board, yeah. After
Yeah.
national board is all forgotten.
Yeah, exactly. And there's and I think there's issues with that, is because if we look at and the homunculus was originally described in my training to look at stroke models. Okay, so if you have less blood flow delivery to this part of the brain, like this is, you know, really affected, and this is why we see people with a lot of these end stage diseases, especially in brain health, become really impaired in the function of these areas of the homunculus, like dysgeusia, right, and all sorts of different symptoms. But putting it together and understanding from the airway route and the dental route, it's something that I've never put together before, especially in training. And it's not really until 2018 that I have. Go ahead.
And may I add another point? And that is, you know, medicine is excellent at studying end stage conditions, like ICU conditions, right? Like morgue, all right? But what happens to the patient on the downhill slide to ER and ICU, all right? It's one thing about doing heroic rescues and surgery and open heart and brain surgery, but what about proactively preventing the patient from reaching there? Like if you have a family member, if you have your kids or your parents, would you really want to wait until the very end? And if not, then what are the clues that we can pick up on the downhill slide long before the patient becomes, you know, a hospital admission for critical care, right?
Right.
This is something that is not sexy, I guess, in the medical world. It's not heroic, therefore, and I feel that the dentistry's success with preserving teeth can be brought into this discussion. Yeah. In other words, denture by 50 was a standard expectation. Now we don't think that way anymore. I mean, you wouldn't expect any one of your kids to lose a tooth ever, right? That's how far dentistry has come. But in the medical world, I mean, we're still, you know, in the middle of a war on cancer, on diabetes and obesity and all of those things. So there's a model that we need to adopt in order to improve the efficacy of overall healthcare.
Right. No, absolutely.
Yeah.
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 And so, and now we're going to jump into really the next section, exactly how we actually do that. So we're going to be really specific and going how we're going to do that. So, but let's talk about the oral cavity, the nasopharynx, and the airway first as an entire anatomical structure, because a lot of people think that depression or ADHD or bipolar disorder is purely a chemical imbalance. So we have to define the term imbalance because our body has an amazing way to create balance in ecosystems that have imbalance. And so our body's natural reaction to something is to either activate the sympathetic system, which is the fight or flight, or the parasympathetic system, kind of the rest and digest system. So if the body and the brain is operating in this sympathetic system, then a lot of what we see in brain function, brain neurophysiology, changes to this sort of the excitation dopamine dominant state, where the cortisol spikes, the stress hormones, stuff like that. And majority of the time, it actually starts in the airway because the body feels like there's a lack of breath, and breath offers life. So Dr. Liao, let's have you kind of explain the crucial factors when it comes to airway health first.
Okay, sure. So I gave a talk about 2 weeks ago in Chicago, and I feel that the role of the mouth in terms of the airway obstruction and hypoxia resulting has the potential of unlocking this healthcare industry-wide blockage on why can we get our patients well. You know, the body maintains homeostasis really by doing breathing and eating and proprioceptively standing, as well as digestion. All right, so there's a paper put out by Paul Chek called Totem Pole Hierarchy of Survival Reflexes, and he says that the most critical reflexes are for eating, breathing rather, number one, then eating, vision, hearing, and then turning the head by digestion, reproduction, standing, and walking. So if we look at this, the mouth is on top of that totem pole. Okay, just like how we were born and what we, as newborns, what we needed to be cared for in order to survive. So in this diagram of mine, I could only fit in 3 colors before it goes too crazy. So green is air, and red is circulation, and yellow is digestion. All right, but actually the close-up look of the oral pharynx looks like this. The air enters the nose, and I call that zone 1, and it goes behind the soft palate, I call that zone 2, and then goes behind the tongue on its way down to the trachea, which is ringed, by the way, and therefore it never collapses. But zone 2 and 3 are not ringed. It's a muscle tube. So it's susceptible to collapse in its narrowest zone. And these narrow zones are actually determined by zone 4, the size of the oral cavity and the compatibility of the tongue. So if you have an oversized tongue and in an undersized jaw, now you have a big problem. And I submit to you that all the leading causes of death in the United States and worldwide, other than infections, has everything to do with diet and airway obstruction. All right.
Yeah.
So I'm talking about the chronic illness part. Okay. And so the role of the tongue, the role of the upper airway, the size of the mouth has everything to do with it. And here's a very simple thing. I have physicians who would talk to me after I give a lecture and say, I know I'm supposed to look inside the patient's mouth, but I don't know what I'm supposed to be looking for.
Mm-hmm.
And I said, well, here's a very simple thing. Does the tongue fit inside the two jaws? And clearly, when you look at this, it cannot possibly. When I teach dentists on how to become what I call airway mouth doctors, you cannot widen this jaw enough in order to accommodate this tongue. So dentists, airway mouth doctors on their side needs to recognize certain tongue conditions must be co-treated by physicians so that the tongue could be non-pathologically sized and the jaw could be adequate in its 3 dimensions of this cage to contain this tiger. You know, the tongue doesn't want to be a tiger. The tongue wants to be a tongue. And it's become as a tiger because the jaw's too small, or the patient gained too much weight, or it's hypothyroid, or it's put on, the patient is put on steroids long term and they puff up. And so this is what happens. And in the mouth, very simple things. All right. I ask my dentist colleagues all the time. In fact, I just gave a training yesterday and the day before. And you just look to see what percentage of your medical patients got crowded lower front teeth. So the answer I pulled from my dentist who said in my class is somewhere between 80 to 90%. That's a huge number. When we 80 to 90% of the patients who's got crowded lower anterior teeth, they have some kind of airway compromise because the cage is too small as a result of this crowding. All right. Yeah. And whether ask the patient if you grind your teeth. And all of these conditions are related to that. Okay, go ahead, sir.
Yeah, no, absolutely. So I want to kind of piggyback off the things that you said really quickly, because earlier you said that a lot of the top causes of death in the world, and especially in the U.S. here, is can be related to airway issues. And I gave a presentation 4 years ago, which I want to show you, to sleep medicine physicians, and we talk about how sleep disorders are associated with top cause of death in the United States. And I want to be very clear when I say this, that sleep disorders come from airway disorders, right? And I'm not just talking about obstructive sleep apnea. I'm talking about sleep disorder, breathing, and insomnia, hypersomnia, narcolepsy, et cetera, et cetera. So if we just look at healthcare in general, is that we know there's certain elements of healing. So the first part is that if you don't sleep, you can't heal. And if you can't heal, you can't regenerate. If you can't regenerate, you degenerate, right? And the biggest part of regenerating or degenerating is vascular beds. So we actually look at vascular beds, for example. Let's look at this, for example, right? So if you can't sleep, then you're going to be creating what's called oxidative stress and inflammation. And that leads to vascular disruption, which can lead to really bad disease states and brain health states, vascular dementia, even Alzheimer's dementia as well. And so these disease states used to be thought just come from chemical reactivity. Well, that's not the case. It's not just from chemical reactivity. It's caused by oxidative stress. If you look at this first bullet, it's oxidative stress. Part of oxidative stress is not enough of the components that's needed to make things inert, make toxins inert, and that's comes from airway, and it comes from breathing. So you get cortisol spikes, you get atherosclerosis, and you activate what's called the inflammasome pathway. And then if you actually look at cancer, for example, right? So this is a cancer curve of sleep deprivation. So there's people who are hypersomnia, sleeping a lot of hours, they'll have high cancer rates, and people who don't sleep a whole lot, having higher cancer rates. And you have the sort of magic number here at 7, not because 7 is the magic number, but 7 is the average number that we see. So we see there's rates of cancer that's associated with this, and this is why sleep disorders are really important to be diagnosed. How about accidents, right? That's the number 3 cause of death in the U.S. So hypersomnia, driver sleepiness, that could be related to that as well. And then unintentional injuries, right? You have issues with airway, which leads to issues with proprioception. If you can't breathe correctly, then you can't activate nitric oxide. Nitric oxide's job is to perfuse the brain and also protect the body from insults such as periodontal disease and other infections, and that causes these issues as well. And then mental health as well. So let's talk about 50% of adults with anxiety have some sort of sleep disorder. That's the ones that are diagnosed. The rest of them are probably just not diagnosed. You have 46% of children with sleep problems develop anxiety-related psychiatric disorders later on in life, and especially early on in life, even with ADHD. 24 to 36% suffer with chronic insomnia, and 27 to 42% suffer hypersomnia. And so all these really start with the ability for the airway. I'm going to end on this slide real quick. This is the most important thing that we have to understand from a biochemical standpoint. So whenever we consume amino acids in the form of L-tryptophan, so tryptophan eventually turns into serotonin, which makes you happy, and melatonin, which makes you sleep well, right? And so melatonin also activates stem cells, activates the healing mechanisms within our body. So in order for L-tryptophan to go all the way to serotonin and all the way to melatonin, what's needed is breath. So if you have impaired breathing or mouth disordered breathing, your neurotransmitters don't fire this way. There's an alternate pathway, right, that are fires into dopamine. And dopamine is sort of the excitatory neurotransmitter. And then there's another pathway that follows, which upregulates with glutamine, glutamic acid, which is also an excitatory neurotransmitter. So a lot of what we see in mental health is that, doctors are trying to prescribe like SSRIs and antidepressants to upregulate serotonin or temporarily upregulate serotonin in the synaptic junction. But the problem is way upstream, is that the conversion, the phosphorylation of tryptophan, that's determined by your oral microbiome and your gut microbiome. It's also determined by the amount of air that you receive. It's also determined by the number of hours that you sleep. If this pathway is not improved, then there's going to be a failure of medication, which is there's about a 60% failure of medication when it comes to antidepressants, creating sort of this serotonin effect. And this really starts in the mouth and the nose. And so if people understand that there's a directional pathway converting neurotransmitters from these amino acids, and literally the ability for you to breathe is going to be the limiting factor there, then we know that we really have to look at the airway as the biggest issue of all of mental health and brain health. And the last thing I'm going to say about this is that, okay, so you've heard this concept, right? Take 10 deep breaths, soft belly breaths, you start feeling better. And you literally can increase your serotonin production by taking 10 soft belly breaths. And we see this a lot. There's functional MRI studies and we have quantitative EEG studies showing that. But if you can do it consciously during the daytime, but when you're asleep, right, and you're breathing involuntarily, and if you have impaired breathing, then you have an entire night where your body is not going to deep sleep. It's battling dopamine. And then dopamine's keeping you either in light sleep or awake, and you're tossing and turning at nighttime. And then your brain's like, I don't want to do that, so I'm going to contract my masseter muscles. I'm going to contract my sternocleidomastoid to allow the air to open up at nighttime, which causes the TMJ issues and the bruxism and the grinding and stuff like that, right? And so it becomes a constant battle. And that turns into chronic pain issues because all the muscles right here are so tense, all the fascia is so tense, there's so many nerve endings right here, it kind of pulls people up by the neck, right? And so your body's trying to buttress for an open airway, and that turns into chronic neck strain, fibromyalgia, and chronic pain syndromes. And this is why chronic pain syndromes and fibromyalgia is related to depression, is related to anxiety, because the neurotransmitters aren't there to produce the actual effect. So the body's in persistent fight or flight. Go ahead, Dr. Liao.
Yes. The body is actually confronting death when you have sleep apnea episodes. Can I share a couple of slides?
Yeah, you're co-host now, so you can share. So
Okay,
share on
thank
the
you.
bottom.
All right. All right, can you see my screen okay?
Yes, sir.
Here's a slide of the upper airway cross section. So you can see zone 1 where the air first enters the body, assuming that the patient is not a habitual mouth breather. This is how physiology should work. But most of the time we find zone 2 and 3 to be the choke zone, like what you see here. Okay, so in this lower right image, white is 400 square millimeters in the oxygen pipeline. Black is 100. So you have a choke zone here. This is where apnea happens. So why does it happen that way? Because this patient has a tongue that I metaphorically called it a 6-foot tiger, and a underdeveloped set of jaws that is too small for this tongue. And when you see that, it's my clinical experience that you will see this in called Liao sign. If you look at a patient in profile, this upper lip drops straight down. Okay, so when the upper lip drops straight down, it means that the maxilla is what we call retruded. So this is protrusion, this is retrusion. A retruded maxilla and a undersized maxilla and or mandible with crowded teeth. And a history of orthodontics is a clue that they had crowded teeth. Okay, that their teeth look straight doesn't mean that they don't have airway issues. It may be that they had teeth taken out and the orthodontist lined up the rest of the teeth by closing the space vacated by the extracted teeth. So if you see patients in profile, start asking them if they have dental issues, TMJ issues, as Dr. Cheng so astutely pointed out, teeth grinding at night basically is not helping the patient sleep. The mouth and the body is actually running a marathon, trying to stay alive. And these are all the conditions. So crowded teeth, TMJ, chronic pains in the head, like Dr. Chen says, snoring, sleep apnea intolerance, they all have an oral contribution to this. So does fatigue, anxiety, depression, and irritability, never mind the metabolic diseases. And so when we look at the leading causes of death, it's not just the diet. Of course, you are what you eat, but you're also how you sleep and how your lifestyle affect your whole body health. And it all starts from here. So that's a quick summary of what this is about. The oral contribution to this systemic issue, because the mouth doesn't just deal with eating and smiling like the typical dentist would have you believe. When you go to a dentist, oh, it's all about a smile. Patient get in front of a dentist camera and they just go smile. Well, the mouth structure actually is an incredible piece of engineering. And when the kid is underdeveloped during the formative years, they really have a big problem. And the big problem is that for the rest of their lives, they're stuck with a 6-foot tiger in a 3-foot cage. And that is going to affect alignment, breathing, circulation. So alignment has to do with pain, breathing has to do with apnea, circulation is hypoxia, digestion has to do with inflammation, energy, of course, is fatigue, and the lack of ability to come back from any challenge to homeostasis. And sleep is, of course, how you recharge your battery and refill your tank.
Awesome.
Back to you, Cheng.
Thank you. I'm gonna piggyback on your mantra here and show y'all this. Can you see my screen?
Yeah.
Okay.
Yep. Yep.
Now let's prove it. Let's prove what you said actually is a thing. So this is a neural mapping or brain mapping. It's a device called BrainView that we use in the office here. And what we look at are brain and mental health disorders, but we also look at is treatment efficacy, right? And so if we look at someone right here, and this is a 17-year-old with bipolar disorder who came to us, and she was not in a great shape. A lot of suicidal ideation, a lot of depression going on, and just really, a bit abandoned by her family. And so her mom has been rejecting her for the last couple of years. So her aunt brought her in, and we notice. By the way, this is a before and after. So on the left-hand side, we notice that her alpha frequency is sort of this dark blue, which means that she is the one that has trouble activating that serotonin pathway and the melatonin pathway. And we notice that her beta frequency is like the opposite, and it's like this bright yellow orange, which we call high powered frequency ratio, which means that her brain is always in this persistent hypervigilant state, go hypervigilant state, right? And so we eventually got a sleep study for her because this is someone who's very typical of sleep disorders. Her initial 2 sleep studies were negative, okay? Meaning that, I shouldn't say negative, it just didn't meet the diagnostic criteria for obstructive sleep apnea, both an in-lab as well as a home sleep study. And later on, we got her a different sleep study with something called a PES, which measures esophageal pressure, and that diagnosis was severe obstructive sleep apnea. And so what happens is that they also did a daytime study, and she actually had this syndrome called narcolepsy, where your brain transitions into the sleep stage. And narcolepsy is heavily underdiagnosed in the mental health population. So now this on the left-hand side, this is the before. On the right-hand side, this is the after. So before and after what? So this is actually before and after oral appliance for about 2 months. And we see that her brain is like lifting up on a lot of the dark blues on her alpha region, and her brain is no longer in this persistent fight or flight stage as much as it is before. So symptomatically, she was getting better. And also on her brain mapping, we're seeing this significant improvement as well. And so this is sort of one of the first aha moments that I had a few years ago of saying, hey, you know what? If we just do this, we're able to improve people's quality of lives. Interestingly enough, she was able to eventually get off some of her medicines after about 3 to 4 months, because her body is just less starved to allow the healing mechanisms to occur. And so this is one of the first cases that I've kind of seen that really gave me that different perspective. Now, that's not the only one. Take a look at this one, 67-year-old female before and after on oral appliance, right? She had really high power theta 1 region, which means that her brain was literally falling asleep during the daytime. Chronic fatigue, falling asleep, inattention, et cetera, et cetera. She had a really high theta alpha ratio, which means that her brain is much sleepier than she is concentrated. So this is technically a marker of attention deficit disorder. Look at this. This is just a couple months afterwards, right? We can see that her delta is becoming better. Her theta 1 is no longer this dark yellow, which means that she's no longer as sleepy. She's more alive. She can stay awake past 5 p.m. for once, right? And so this is a huge difference. And we didn't do anything else, by the way. And this is really important. And for her, she always thought that, hey, you know what? I'm just a negative person, my whole life, and I don't see things the right way as it did. And this really honestly changed her life because her brain frequencies changed quite a bit. And she, by the way, she was diagnosed with mild cognitive impairment, which is the early signs of dementia, which afterwards, she didn't have any of that stuff. She was fine. She had a lot of what's called the sleepy brain phenomenon after the appliance. And so one of the reasons is also this, and this is really, really difficult graph to know unless you kind of know what you're looking at. So I'm going to break down for you. And so what happens is that when the airway is compromised, we have this system that goes completely awry. Light will come into the eyes, And on the back of the eyes, you have this thing called a PGRC, and these different receptors that tell the rest of the brain the circadian rhythm, circadian clock. When you have issues in your mouth, whether it's airway disorders or periodontal disease, okay, this completely goes backwards. So a lot of people are laying awake at night with chronic insomnia, and this pathway actually suppresses multiple portions of the brain, like the pineal gland, and then it suppresses melatonin. And a lot of these people during the daytime, the actual daylight creates almost this misfiring where it causes hypersomnia, which is that state where people are just much sleepier. And this is why we see the brain mapping the way it is right now. And so people are like, well, what can I do about insomnia? Or what can I do about, this brain misfiring? Well, it starts in the mouth, right? You can't do anything else until you actually start in the mouth. Is it going to change a whole lot when I change your diet? No. Is it going to change a whole lot when I exercise more? Maybe a little bit. But if you don't deal with the airway and don't deal with the mouth, a lot of this has a really hard time improving. So, all right, back to you, Dr. Liao.
Yes. Thank you. All right. So I actually have a case to follow up with you on the suicidal ideations. Let's see here. I think this is the step. Yes. Okay. So we were here last, and so I have a summary of what my patients told me about how the oral appliance treatment has helped them with. So I define the impaired mouth as a defective anatomical structure. Okay, this deficient jaws leads to choked airways. You can still eat and drink and talk, and you maybe even smile when you force it, but you can't support your cranial functions. You can support your health with an impaired mouth. And so these are the symptoms that my patients have told me that they've feel a significant improvement on or total mitigations of, and not just a small list, because there's only so much real estate on the slide. And so if you can control this problem, then you can stop this domino effect from ending up as a catastrophe in ICU, ER, or the morgue. And this has to do with even COVID, right? How do you empower somebody's innate immunity? It's through sleep. Sleep with an unobstructed airway, right? And the mouth also contributes to diabetes and heart disease. So I came up with this diagram that shows the stress hormones and cortisol level here. And you need some level of that in order to be alive and getting things done. And so I call this the self-regulation zone. And then you can rise up and meet their challenge if your battery and your physiology is working. And then this is where the patient come to us. Some parts of this downhill slide, all right? I respect greatly you medical doctors, because you have to deal with patients who come in 1 foot in the coffin, sometimes both, okay? 9 toes in, right? We deal mostly with this stage here. But whatever it is, getting the patient back up this hill to restore their physiology takes a lot of energy. So the question then becomes, how can you recover from an empty tank? And the answer never changes. It always goes back to sleep. It always goes back to the parasympathetic state in the brain, okay? So the tyrosine tryptophan conversion, it goes to either sympathetic or parasympathetic. So teeth grinding puts you in a sympathetic mode. And so in this mode, the patient never has just teeth grinding. So that's a failure on the part of dentists who see teeth and nothing but the teeth. All right. The urologists deal with the bladder and they don't look up above the navel. Okay. That's actually not true. It's changing. I have a urologist who refers to me for oral appliance therapy for his ED patients. All right, that's really forward thinking, right? But every patient who grinds teeth has a syndrome of symptoms. All right. And I had a dentist from Spain yesterday who said in my class that, God, I have all of these. All right. So we need to start connecting the dots rather than staying in our lane. We need to reach beyond our silos and say, okay, what else can we do in order to heal this patient in front of us? Because that's the important thing. The patient really doesn't care what your degree is. They care about what? Get me well, right? That's why they come. So I have this score sheet. It's very simple to fill out. On the left side, it's the mouth, the oral symptoms. On the right, it's the medical symptoms, sleep apnea, for example. And this side may be malocclusion or teeth grinding. And so I had this patient who reached out to me from Australia. She checked every box. So 1 is yes, 0 is nothing. Okay, and this is how we can keep track. So she has a 0 on the medical side out of 16. She's got 2 on the medical side out of 16. Everything else, okay, is a yes. And this is what she looks like. Straight white teeth, but miserable owner. Okay. She hurts. She's got, you see a tooth print on the side of the tongue here? That means that the cage is too small, all right, for the tongue. And she has suicidal ideation. And that's why she reached out to me. She wanted to stay alive. And here's a patient who's got only 1 pair of premolars when she should have 2 in each quadrant, okay? The premolars are the teeth between the canines and the molars. And so she had orthodontics done. So that's why her teeth look straight. But you see, after that, her lower front teeth are still crowded. So how many teeth do you need to take out in order to get her teeth all straight? I would tell you that teeth grinding, straight teeth is the wrong criteria for health. But that's just kind of like a socially cool thing to do. I think we doctors should really look at homeostasis capability. And as a result of having the teeth amputated, okay, and not having the tongue correspondingly reduced, she is stuck with a 6-foot tiger and an 8-foot and a 2-foot cage. All right, so the ratio is worse. So let me show you what happens after she got treated. I just skip ahead here. Okay, so we give her an oral appliance, and this is what she looks like in 11 months. And this 3-finger test is a battlefield evaluation on how, whether or not the patient has TMJ. Just like if you can jump on an ankle, you can fight. You can be a soldier. Here, you can pass 3 fingers between your incisors. You don't have a TMJ problem on a gross level. Okay, so her entire facial complexion changed. Not only that, so let's look at the syndrome of symptoms. She came in with 7 principal complaints, cheek complaints. So they're a mix of medical and dental. So jaw pain, dental, here is medical, mixed, medical, 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 medical. All right. So on a scale of 0 to 10, she averages 9, okay? 63 out of 70. Well, half a year later, it went down to 21. All right. For a total of 67% improvement. All right. So this is across medical and dental symptoms. So we summarize it in this bar graph here. Her quality of life was this little. And that's why she wanted to kill herself. She couldn't get any serotonin. Okay. Here, it's restored. I wish we could get your brain scan on her, but when you look at a face, you can tell that it works because This is a reflection that her sleep and her airway is not working. It all starts with this upper airway evaluation. All right, so you look to see if the tongue fits. If the tongue sits over the lower posterior teeth occlusal surface, the chew on top of these lower posterior teeth, the mouth is too small. The jaw is too small for the tongue. Okay, when you ask the patient, did you have teeth taken out for braces? If they say yes, you got a double, triple, quadruple problem. Back to you, sir.
Awesome. So now that we've looked at that, and I'll be respectful of everyone's time, the last few minutes I kind of want to show you some evidence of all this, because this has been studied before in the past. So let me just open up this set of slides. By the way, Felix, this was really fun. I've never done a medical dental collaborations like this before, but this is a lot of fun. Okay.
I'm learning.
Okay, so it's not surprising. There's let's get to the chemical part now, because there's also link between periodontitis and Alzheimer's disease. That's been known forever. I mean, they even post-mortem studies, cutting into the brains of amyloid plaques have developed in Alzheimer's disease. We see gingivalis and spirochetes and all sorts of stuff from the oral cavity. So this first study is actually from 2021, relatively recent, and looking at the associations, and we know that those people with dementia show significantly worse in clinical periodontal variables. But the cause and effect has been kind of debated, right? But let's go to some actual case. So this is another 67-year-old female, chronic pain, fibromyalgia, chronic hydrocodone. Ashley came to us because she really wanted to get off of her medications and try to figure out, hey, how can I improve my life? I have lupus, I have rheumatoid arthritis, I was diagnosed with Sjogren's syndrome and Hashimoto's, and I'm having increased forgetfulness and memory issues that is really plaguing me and affecting all parts of my life. And also she was like, I was also diagnosed bipolar and schizophrenia. And neurological symptoms wise, she's got peripheral neuropathy. If you walk into the doctor's office like this could be very overwhelming for a lot of physicians, right? But the thing here is that every one of these things can be tied to mouth issues, right? And not surprisingly, they are, because let's look at all her $1 million workup that she's had. She went to neurology, had normal EEGs, MRI, MRA was normal. That's about $25,000 right there. Another $8,000 for an EMG, electromyogram, but except that she was diagnosed with small fiber neuropathy, which all they do is kind of throw medicine on it, right? And she had sleep study, but it was negative for sleep apnea based on the airway criteria. But that's a home sleep study, which is not the most sensitive, but does have some upper airway resistance syndrome and rests legs. And so if you look at our workup, now it becomes a little bit different, because we start focusing on the skull rather than the actual brain, right? Or the immune system. And so we see that on the brain mapping right here, you see this top row that's like super red right here. That's, red. It's quite abnormal. This top row is the sleep frequencies. And we're seeing that she has a significant amount of what's called sleepy brain phenomenon. Her brain's just kind of sleepy all the time. She's got some issues with attention, theta beta ratios, decreased auditory processing, and all sorts of different things that are right here. And so our brain mapping device has an algorithm that gets what's called predictive analytics. And she was very distraught when she saw that, oh my gosh, I have this dementia marker right here. I have this impaired symptoms that are right here, and I'm very scared. And for us, well, there's nothing to be scared about if we focus on the right things. So we know based on her sleep studies that she's got some upper airway resistance, not necessarily full-blown sleep apnea, but that's enough to make things really bad. And so we found her labs, she has really high CRPs, which is inflammatory factor that's in the blood work. And we sent her to ENT because she had, she basically talked through her mouth the whole time, and she didn't realize that was abnormal. And so we picked that up, and she had a completely obstructed with complete obstruction with turbinate hypertrophy and bilateral ethmoid sinusitis was completely opacified. Now, I told you earlier that she had a quote unquote normal MRI, MRA, right? Well, it wasn't normal. As it turns out, I went back to the images. The radiologist never commented on how opacified her sinuses are because they were focused so much on the brain, right? And that MRI was like 6 years old. And I was like, did no one talk to you about your sinuses at this time? Like, she's like, well, not really, because she didn't really think it was a problem. So she didn't really mention it, right? And of course, we sent her to a biological dentist, found that she has severe perio, microabscesses literally everywhere, and one of them extending into her left maxillary sinus. Okay, and bilateral nasal valve collapse, and she also has some impaired airway syndromes as well. So a lot of what we found for her, I was like, hey, you know what? In order to improve your pain, in order to improve your autoimmune disease, in order to improve your mental health, in order to improve your memory, in order to improve your quality of life at this point and any chance of getting off of narcotics, we have to look at your entire head and neck as the area to really just focus on. Forget about everything else. Let's just focus on that. So, of course, the reason she's on my slides is because she's an amazing success story. So she had a lot of things done. She had deviated septum corrections, she had periodontal treatment, abscess drainage, et cetera, et cetera. And just 67 days later, right, her brain looks like this. Her frequencies look a lot normal. Her frequencies look a lot normal. She ultimately had an in-lab sleep study showing that she had moderate to severe sleep apnea, not a negative sleep study, quote unquote. Initially was on BiPAP, and then while she's on BiPAP, went for appliance, and then after that, she went for mandibular advancement device. And so just 67 days later, we were able to get her completely off of hydrocodone, completely off of narcotics by focusing on the airway and focusing on the skull, right? And
well done, well done, well done. Can I add a comment here?
Yeah, go ahead.
So, as an engineer, I'm always doing the CSI, crime scene investigation stuff, right? So the question is, why did she have so much periodontal breakdown in the first place? All right. So the inflammation that is a hallmark of periodontal disease it really is either from having a sweet tooth, which is an orally mediated habit, and hypoxia. Because when you have hypoxia, you increase the virulence of periodontal pathogens. And that's proven. All right. All the SIBO stuff, all the gut dysfunctions is going to directly impact the brain and impact the oral microbiome.
Yeah, no, absolutely. And I agree with you.
So she lost homeostasis. She lost the ability to maintain homeostasis, and it shows up in the mouth, in the brain.
Absolutely, I agree. And if we look at symptomatic improvements, right? She's had chronic migraines, and it's been gone since 1997. It was gone for the first time ever since 1997. She's had migraines. Fibro improved 20% or 80% in 20 days after dental work. Got off hydrocodone, but still on gabapentin, which is okay. It'll take some time. And then her labs, she was basically had all her autoantibodies was no longer showing. So she no longer met the diagnostic criteria for lupus and Sjogren's syndrome and stuff like that, which is very interesting. HSCRP went from greater than 10 down to 2.8. And then she has significant memory improvement. MoCA, which is a Montreal Cognitive Assessment Score, is pretty much normal. Before, it was very much impaired. And she lost 22 pounds in 4 weeks. Literally didn't do anything. She doesn't think she did anything. But honestly, her activity improved, her mental health improved, her breathing improved, her metabolics improved, her immune system improved, right? And she requests to get off of disability and go back to work, And this happened literally in a couple months. It didn't take very long, but the obsession here is looking at things that are starting in the mouth. And so, well, are there things previously done in other studies looking at mouth and obstructive sleep apnea and characteristics and personality traits? Absolutely. This is actually published in the Journal of Psychiatry Investigations of looking at upper airway resistance affecting personality syndromes. Also, people with EUARS are generally have more neuroses and sensitive personalities. Now, why is that? It's because the brain is naturally in that fight or flight stage. And so this is where my compassionate side of my brain kind of comes in. It's like, you know what, there's a lot of people with mental health issues, but honestly, could it be something that is far more prevalent, which is upper airway resistance, which the answer is probably yes. And so we know there's those people with upper airway resistance and OSA have a 5-fold increase of Alzheimer's. And then we also have chronic hyperperfusion syndromes with sleep apnea and cognitive impairment. And here's OSA and Parkinson's disease, right? And so the data has been there for a long time. The problem is they're like, well, here it is, right? Here's the actual data. But the problem is that we actually need a collaborative approach to get this all taken care of for our patients, because honestly, some people are so close to success and they just don't know it. And this is where we really have to put our brains together and say, hey, you know what? Let's create the success path for you between the medical and dental. Yeah. Awesome. So I want to be mindful of everyone's time. I went a little bit over. I'm sorry. But I just kind of wanted to end is that I have a retreat coming up May 27th to June 1st, and all of you are actually invited. And so Dr. Liao will be there, and we're actually going to do a whole workshop, literally a whole workshop on this. And what we're trying to do is create an algorithmic approach between medical and dental and mouth doctors, et cetera, and ENTs to focus on the solutions rather than just presenting the problems over and over again. So we call this Doctors Development for Growing Adult and Children's Best Faces, and we're going to be in Costa Rica. So I'll email out this to everyone a little bit afterwards, but we're going to be doing some really amazing things over there. And so this retreats actually is part of my nonprofit. Is the nonprofit is actually focused on ending suicidal ideation as well as depression in health professionals, especially medical doctors and dentists and other health professionals. And part of what we're doing is not just talking about like mental health and suicidality in terms of, okay, well, let's do some yoga and call it a day. No, we're going to talk about how we can now collaborate, just like some of these cases I have here, to say that, hey, even within the healthcare professional population, we have to focus this within our own population first before we can help somebody else. And that's exactly what we're doing in this retreat. And I'll email that out to everyone. And so Dr. Liao.
So can I just share?
Yeah.
Can I just share quickly, flash a few slides in front of you about the best face part?
Yeah, absolutely. Mm-hmm.
Okay. So we can bring out the best version of your face non-surgically and without injection, without pain. All you do is wear a mouthpiece to sleep. So here's a lawyer who gave birth between 2019 and 2022. We got her this result without doing braces. All right. And so how can you look better after you give birth? Right. So that's now within the realm of possibility, because when you sleep better and you eat healthier, it's going to happen. Same thing with children. Crowded teeth absolutely is a sign of jaw underdevelopment. And jaw underdevelopment gives you a smaller cage for the tongue. So you have now an undersized frame for the tongue to stay in, and that's where the obstruction comes in the airway. And we can actually do this now predictably without braces, okay? And when you get the maxilla right, the rest of the body goes right because we grow from the top down, all right? And so this is predictable. She was 11, she's 13 here. Okay, she was starting braces, and mom took my class and said, "No, we're gonna go with Felix's way," and this is what she looks like today. Right? She will never have any childbirth difficulties. She's winning debate and speech tournaments. She's trained to be a soprano, and so high achievers. So brain works well when the body can sleep well. That's all there is to it. And so this is possible for adults and children alike now. And it's really exciting. So I'll get off.
And
Back to you, Dan.
Yeah, thank you. So the rest will take any questions put into the chat box. And I see Monique asked the question first. So let me just stop recording real quick.